I do have a pretty interesting study to talk about, and this actually is related to me. Well, sort of. It's a study about, are women better surgeons than men?
Oh, wow.
And it's an interesting topic because I do think that it's obvious that men and women do have some different personality traits, and so are there certain personality traits that would make women better doctors or better surgeons? And this is something that has been looked at in the past, and really historically has been like, yeah, it's just everyone's more or less the same. But a new study came out just recently. It's a study out of Canada, which is interesting, and we'll talk about that was looking at the differences in outcomes between male and female surgeons.
Yeah.
And so it had like 1.1 million patients, and 90% of them had been operated on men and 10% had been operated on women, which actually that's kind of important because the groups are pretty different. And it looked at the death and the complication rate at 90 days in the year, and the females had an edge. And I tried to actually look at the metrics of the study, and I couldn't pull. I had to buy the study where it was posted. I couldn't look at the whole thing, which I would have liked to seen how much detail they went into as far as trying to make everything equal.
Yeah, if the surgeries were high risk or not.
Right. Yeah, and it did say that it tried to equalize for those sort of things. There are some things that I think it may not have that I'll talk about. And so, in the first question that pops up, is this real? Because a lot of times studies will come out that suggest one thing or the other, and it doesn't say this is a truth. It says this study suggests that X, Y, Z. So the first question is, this is real? And I kind of believe it's not, and I'll kind of go into that. And because I guess the next question would be, okay, if it's real, why?
Yeah.
Why is it that one gender would have a better outcome in surgery? And so I think, okay, well, what makes a good surgeon? Well, intelligence for sure. I mean, you can't have people who are not really intelligent being surgeons. Manual dexterity, because surgery is a lot of manual dexterity, which generally men get the edge on that, but it seems that women, once they get trained, it's like video games, right? Historically, men are better at video games, but if you train a woman up, they're equal.
Yeah.
Attention to detail, and that one's more or less the same. Confidence. The one thing I do think women do have an edge in, this has been pretty demonstrated, is women are better listeners.
Yeah.
And so, it's like, okay, well, could that play a part in it? It's very possible that I think for certain specialties, for sure, being a better listener can eliminate risks of misdiagnosis. And we talked about that when we talked about how women oftentimes will get misdiagnosed more than men from the patient aspect. But so I wanted to compare it to some other studies. There was a previous study out of Canada. I don't know why Canada is the one that's always pulling them, about 5 years ago, that suggested the same thing. And then I looked back, because historically I had looked at this topic previously for something, and historically the answer has been no, there's no difference. So there's two big studies one's out of Japan and one's out of USA. And I'm just going to post these if anybody wants to look them up. This is the one out of Japan from the British Medical Journal. That one's from 2022. That's pretty recent. There's another one that's a little bit further back that's from the USA. That's a really big one. That one's pretty interesting because that one showed that although the sex of the surgeon didn't make a difference in outcomes, the age did. Older surgeons tend to do better, which obviously that to me kind of makes sense. The more, the more
practice.
Yeah, the more practice you do, that you're going to have better outcomes. So, looking at this, I feel like it probably does boil down to the things like you're talking about, like what exactly are they looking at? Because there does be a tendency for women physicians to pare their practices down a bit. Now, that's not across the board, but it is a generalization that does carry some weight, that, female practitioners will tend to maybe not do as much as the men. And so it might weigh into like the patients that they see. So I think probably it has something to do with that. It could have something to do with training. The fact that there's only 10% women in Canada could potentially cause women to have better training, because programs want to have a diverse group of people, right? I mean, just like anything. And so when there's less applicants for say surgery, they do tend to get better spots, right? Because they're like, oh, if there's only 1 out of 10 applicants are women, then programs are going to want to take them. And so
Yeah.
it could be that just the women in Canada are better trained. You know, when you compare them to the large group of men surgeons that would include both good training, bad training.
Yeah.
You know, so that's a possibility. I do kind of believe that probably it boils down to that, unless I could think of a reason why that it would be accurate, you know. I mean, if every study said that.
Why did they do that study in the first place?
I mean, honestly, probably for headlines. I mean, you know how
Okay.
it is these days. Like something
Yeah.
like that's going to be. I mean, it's like blowing up on social media. Like, oh,
Yeah.
women are better, you know, surgeons, and you know,
And,
it
like,
makes.
was there like a concern about it? or
I mean,
something?
yeah, right. So I think
what I'm
probably
like, why
because
would
it was
they
from
waste
the
their
it was
money
from
on
that first
doing that?
Canadian study, which showed something similar. This one I think looked at longer metrics. I think the first one was looking at what's the 30-day mortality rate for men versus women surgeons, and women had the edge in that one too. And so I think it's the same hospital
Did they
group.
were they like doing like heart surgery, brain surgery?
So they
like,
they were trying to equalize that, and that's why I wish I'd actually gotten a hold of the study, because I like to look at studies and pick them apart and be like, okay, because when you do that, and that was the thing that we did when we were in training, we did what's called journal club, and so in journal club, one of our favorite things to do is to actually take a study and dissect it and say, okay, is there areas of this that don't pan out? Because I mean, I don't know if you guys know this, but I mean, a lot of people that do these studies, it's not like the big famous doctors do them, and usually it's like the people. I mean, I did studies when I was a resident. I didn't know any. I was doing studies on molecular research. I mean, I'm not like a molecular biologist. You know,
Yeah.
I was just basically doing what people were telling me to, and that does happen where, you know, people do these studies. So it's like you do have to kind of check and make sure that they're legit, and
For sure.
that the outcomes are expected. Because this is an unexpected outcome to me. I mean, I would think that, you know, given equal training and doing equal cases, you'd think the outcomes would be similar.
Yeah.
So if it's not, it's like, why is that? So I don't know. I'm sure that some more studies will probably come out that try to figure that out, but I don't know if they'll pan out and say the same thing. But
Yeah.
it's interesting. I do think that there are specialties where women would have an edge, and you know, ones where listening is such like a huge component. Which in surgery, I mean, it's always important to listen to your patients. But like, you know, when it comes down to a complication, I mean, that's going to be, you know, how sick is the patient? When did you take them to surgery? You know, how good a job you can do, and generally that should be equal.
Yeah.
So, but it's interesting. I mean, it makes good headlines, and it's like, okay, why is that? Why does it say that? I don't know.
Interesting.
Yeah,
I
it
don't
is
know. I'm like trying to think of like if I was having a surgery, if I had to choose between having a female or a male.
I mean,
surgeon
having
do
like
it.
worked with tons and tons of surgeons, I mean, I can say that I've worked with amazing male surgeons. I've worked with male surgeons who weren't great, and I can say the same thing about females. You know, to me personally, having worked in a lot of really big institutions and just working with a lot of different surgeons in just countless hospitals, I've never really noticed a difference. You know.
Yeah. I think I've had 3 surgeries. I mean, I
Have you?
guess you could count a C-section kind of a surgery.
For sure,
So
absolutely.
that was a woman, and then I broke my arm in 10th grade. That was a guy that fixed my arm. And then my other surgery, of course, was plastic surgery, and I had the breast augmentation.
Is that a
and
man?
That was a man.
Man, yeah.
So
Well, I mean, the chances of you having a male surgeon are
Yeah.
higher because men
sure.
dominate the field of surgery.
Yeah, for
The
sure.
Canada is really crazy because this one was like 90% to 10%, or maybe it was like 88 to 12 or something. The number of male to female surgeons should be more on the order of like 20 to 30%, you know, which, you know, that's one of the things I had a question about. Why is it so tilted like that?
maybe they're trying. Maybe they made that article to like entice women to.
Oh,
go
for
into
sure. Well,
surgery
it's
more.
certainly, I mean, certainly
Be
that's
like,
how it's
here's,
being.
Here's some confidence,
Yeah.
girls. Go.
Yeah, maybe so. I mean, you know, all the female surgeons I knew where I trained, and I trained at a really, you know, kind of hardcore program. I mean, they were all good. I mean,
I would think being like if I was going into like a surgery, like training for that, I would almost put more pressure on myself than a man would.
it is hard
Like,
for women.
being like I need to prove myself more.
Yeah, and I think that
So
does
like the
play
girls
out.
that get
You know,
get those degrees
Right.
might actually be probably a little
I do
better.
think that plays out. I noticed at the program that I was at, which was a very hardcore, almost malicious program, that the women almost like overcompensated. Like I found that the women at that program just became really hard. I mean, just like, and we all did. I mean, just to survive. But it was almost like they had to like do it even more,
Yeah.
just because, you know, historically, there hadn't been as many women.
Like
yeah.
they already had that thing on their
Yeah.
back, like you're not going to make it. So.
Yeah.
So they had to try extra.
Yeah, that program at one point had allegedly had said that a woman had never finished it. Now this is like many years ago, and of
Yeah.
course, eventually that became not true.
Yeah.
But yeah, it is interesting. I'd love to see. I'd like to see a further study that said that if they could figure out why.
Mm-hmm.
But honestly, I just don't think it's going to come about. I don't think they'll be like, oh yeah, this is why, because I personally don't believe that it's probably related to anything real.
Yeah.
Personally, I mean, we'll see. It's interesting to talk about, and it does make good headline. People are going to be talking about this for a while.
Yeah.
So.
I wonder if it'll change the amount of female surgeons or surgeries being performed.
My biggest concern with surgery these days, and man, me and my colleagues talk about this a lot, is just the differences in training these days and how the trainings is not as intense, meaning they don't do as many cases. Man, that whole thing about like older surgeons, that does hold true. I mean, people coming out like many years ago seemed to just be more confident.
Yeah.
And nowadays, you just, historically you don't see that. Or people are having to do like years more of training to kind of get to that confidence level because of all the restrictions on work hours and all that. Yeah. It's funny, they did a study. There was a study that, about the 80-hour work week thing? You guys heard about that?
Like the study of well,
it's like the restriction it's a restriction on resident physicians. So prior to like the mid 2000s, there was no restriction on how many hours a resident doctor could work. Mm-hmm. And so I went through training during that time. And so, there were weeks where we did 110, 120 hours. And it's like, well, how do you work that much? Well, you're on call, day, night, day, and then you go home for like 8 hours, and then you come back and you repeat that process. You end up being at the hospital, 110, 120 hours. And it's, it's a horrible thing to go through, but the one thing that is an advantage to it is that you really, really get good because you're just there so much and you're doing so many cases. Well, what happened is that there was a bad outcome at some hospital in New York with a patient, and it wasn't surgery. I think it was ER, or maybe it was I can't remember. And so the resident basically said, well, the reason that I had a bad outcome was because I was so tired. Yeah, I was so tired. And so then this like big thing popped up. We're like, okay, well, we're not going to let residents work like that anymore. So they put a cap at 80 hours. Like a resident couldn't work more than 80 hours. They couldn't be at a hospital more than X amount of time. And so that they implemented that, which that was kind of like right at the end of my surgery training. And then what happened was a study came out a few years later which showed that the complication rate for residents didn't change. Like they implemented all these different studies or these different restrictions, and there was no change in the outcome. Yeah. And so now they're talking about decreasing it even more. And I'm like, what? Like, I don't know. The residencies are going to be like 20 years long. It's going to be nuts. Crazy. I know. It's just.
Well, you definitely don't want a tired doctor diagnosing you or.
Yeah,
or performing some procedure on you.
The one thing I will say is that when you work like that and when you train like that, it's similar to like in the military where they just like beat people to death and then they're able to perform under stress.
Yeah.
I never ever felt like I was too tired or something to do things because you're just trained to work under any condition.
Yeah.
And that doesn't exist anymore. Like that has changed.
Yeah.
So, but I don't know. It's hard to say what's better, right?
You go to doctor boot camp.
Doctor boot camp. I haven't made my own doctor boot camp.
Yeah, you could. You charge money for it.
I know, right? I need to. All right. So, what do you think? Would you rather have a male or female surgeon? Leave me a comment. I personally don't care. I just want somebody that's good. I don't care what gender they are. Huh?
I said for real.
Exactly. I just want them to be good. I'll take anything you got.